Hi, my name is Brittany Mackins. I'm a Cedar Crest College nursing student, and this is my 332 evidence-based practice along with my topic for the paper. So my topic is called medication compliance preventing secondary stroke. Little background, I actually chose this topic because I have family members that have suffered from primary strokes and they are trying to have a better understanding as to how to prevent a secondary stroke from occurring. And I find with them, at least, this is a common thing all over the world, not just in my family or the U.S. It's actually nationwide. So the peak question that I have is: in primary stroke survivors, ages 18 years and older, does medication compliance in comparison not to having medication compliance decrease the incidence of a secondary stroke from occurring? I find this problem significant because, as I said before, in the U.S., this is a huge issue that we have going on right now. Actually, only 50% of the population is compliant with their medication. That means the other 50% is not compliant at all. So that's a huge issue that we have going on right now. Furthermore, patients also believe that if they have short-term use of their medications, it will prevent any type of long-term complications, and that's also not the case. So there's some type of barrier of not understanding what they actually have to do to keep themselves safe and healthy. Also, post-stroke survivors, they also have inadequate education, understanding, outreach programs, support groups, and that also prevents them from getting the proper, from having preventative measures taken to prevent a secondary stroke from occurring. What I used to search for my literature actually was I logged on to Cedar Crest College's website through the library, and I searched through EBSCOhost, ScienceDirect, even Google Scholar. I actually use limiters on those to ensure that I found what I was exactly looking for. So I put limiters such as years 2011 to this present date, full text items, research articles, English only articles. And I also even use keywords such as medication adherence, medication compliance, prevention, secondary stroke, primary stroke survivors. Out of those, after researching all those 3 different search databases, I found 6 articles, but 3 articles were the best ones that I was able to use to create my evidence-based practice, and I'm going to use for my paper. So one of the authors actually, the first article on my list basically discussed how they were trying to study patients that were hospitalized from primary strokes and trying to understand if they had some type of follow-up from being discharged from whatever inpatient facility that they were in. So they did questionnaires. They even did surveys with them. They did them at different timing intervals, at 30, 90, 180 and 365 days. They did these questionnaires to actually grasp an understanding as to how those patients were feeling. How were they progressing? Were they not progressing? That was a good way of also following up with them because patients were much more adherent to following their medication compliance. The second article that I found, basically it was just finding a lot of research, and it proved that 7.4 million people are in the hospital for readmissions for whatever comorbidities that they may have suffered, whatever complications they might have endured. But with them, they are not compliant with their medications. 7.4 million people. So that shows how much that this is a significant problem, especially in the U.S. The last article that I found discussed how cardiovascular and cerebral vascular events were affecting patients, especially those that were trying to prevent secondary strokes. They might have had a lack of understanding or education or any type of tools to ensure that they have a better outcome for their future. So for the recommendations, it was found that more patient tools, education programs, support groups were essentially needed. Those are what these patients need to prevent a secondary stroke from occurring. We can't say that it will completely prevent it from occurring, but it can drastically reduce the incidence of that occurring. Another recommendation that I was able to find was that medication compliance, it improved if patient teaching occurred within the hospital. So when patients were still prior to discharge, if patients were properly educated, they have a better understanding as to what was occurring, and people followed up with them with maybe telephone calls, educational packs that patients can take home, that drastically improved decreased the incidence of a secondary stroke from occurring. Also, even pain assessments were utilized for these patients. They were utilized for patients within the questionnaires themselves, asking patients, what their pain levels were. If patients are having a lot of pain, are we doing something about it? Are we giving them more pain medications? Are we decreasing if they're getting too much? Not giving enough pain medications will actually alter their activities, daily living, thus increasing the incidence of stroke. So in conclusion, I found that proper education and patient teaching is going to drastically reduce the incidence of a secondary stroke from occurring. Consistent long-term planning, long-term outreach programs were also beneficial for patients to prevent a secondary stroke. But overall, patients did experience a drastic decrease in secondary strokes from occurring as long as they are getting the proper utilizations of tools and support groups. So my name is Brittany Mackins, and this is my presentation on my 332 poster talk. Thank you, and I appreciate any feedback.